Why are medical experts disputing evidence used to convict Lucy Letby? Convicted serial killer Lucy Letby is back in the news after a panel of medical experts working with her defense team said they believe the 35-year-old did not commit the murders. The case against the former nurse has been extremely complex from the outset, not least because nobody saw Letby attack the 7 babies she was convicted of murdering, nor did anyone witness the attempted murder of 7 others. Instead, prosecutors had to draw on technical medical evidence, along with statistical data and other troubling details about Letby's life, in order to prove their case. She was found guilty by a jury and given 15 whole life sentences. Senior judges have twice rejected her efforts to overturn her convictions, but a new report claims Letby is the victim of a miscarriage of justice. Who are the experts who believe Letby is innocent? 14 senior clinicians from around the world have analyzed the medical evidence against Letby, including British Dr. Nina Modi, a former president of the Royal College of Pediatrics and Child Health. The panel was assembled by Darshu Lee, a retired Canadian doctor based at the University of Toronto who specializes in the treatment of young children. He said the panel worked without payment and were not familiar with the case prior to reviewing the evidence. Lee became involved with Letby's defense after being made aware that prosecutors had used a 1989 academic paper he co-authored as part of their case. That paper focused on how air embolisms could lead to a baby's skin becoming discolored. It was relevant because prosecutors successfully argued that Letby attacked some of her victims by injecting air into them, causing a fatal embolism. Lee has accused the prosecution of misinterpreting his research, and he has since published an update discounting a link between marks on the skin and air embolisms. Last year, he offered to give evidence on behalf of Letby during her appeal and to say, in effect, that his research had been misused by the prosecution. However, 3 senior judges decided Lee's submission should not be considered by the court on the grounds they said that the prosecution had not at any point relied solely on evidence of skin discoloration to diagnose an embolism. How did the panel think the babies might have died? The new report goes beyond the embolism question Lee has spoken out on previously. BBC News has only seen a summary as a full copy has not been made publicly available. On Tuesday, Lee said the panel believed all of Letby's victims actually died of natural causes or because of poor medical care. There was no medical evidence to support malfeasance causing death or injury, he told a news conference before listing what he alleged were a number of wider failings at the Countess of Chester Hospital's neonatal unit where Letby worked. The report deals with the cases of all 14 babies in turn. In one case in which Letby was convicted of killing a baby by injecting air into its stomach, the panel said their analysis indicated a cause of death arising from natural respiratory complications and chronic lung disease. Additionally, they said doctors had failed to detect a bacterial illness and should have prescribed antibiotics.